and stigma, let's address it. My name is John Ferguson. I'm a consultant dermatologist here with an interest in photodermatology and vitiligo. I've just come up from clinic where I see lots of patients every day with vitiligo and other dermatological problems which are hugely stigmatizing. And this problem is huge for patients, and it's really important to have these sorts of events. This is our first collaborative patient public involvement and engagement event with DermAcademy, collaborating with Changing Faces. So it's just an incredibly important organization for helping patients. Okay, so without further ado, so Dr. O'Leary. So Dr. O'Leary is a consultant clinical psychologist who's worked for many years in the NHS, working in the cleft lip and palate service, the renal and respiratory services. She lives in South Wales and leads the psychology service at the All Wales Cystic Fibrosis service. She received a PhD from the University of London, trained as a clinical psychologist at the Institute of Psychiatry at King's College London. She's trained in several therapeutic approaches, including CBT, cognitive behavioral therapy, interpersonal therapy. She's passionate about supporting people and their families to live well with physical health conditions. Catherine has lived with psoriasis since childhood and has recently written Coping with Psoriasis, in which she shares her struggles with psoriasis and the psychological strategies that have helped her to cope. Catherine.
Thank you. I'll just share my screen. So I hope you can all see that, and somebody will let me know if you can't see or hear me. So good evening, everyone. Thank you for asking me to talk today. So I'm going to talk this evening about my experiences as a clinical psychologist and also as somebody who lives with psoriasis. So this is me. I'm a clinical psychologist. I specialize in working with people with physical health conditions. And I've worked in a variety of medical settings, and currently I work with adults with cystic fibrosis who live in Wales. And I developed psoriasis when I was a child. And throughout my teens and into my 20s, it was extensive and poorly managed. I have a website on coping with psoriasis, and I've recently written a self-help book, which is due to publish next month. So I think of psoriasis as being a bit like an iceberg, and actually I'm going to focus on psoriasis because that's what I live with. But this can apply to all skin conditions and visible differences. So there are symptoms above the water surface that are obvious to other people, like in psoriasis, that's the plaques and the scales. But below the water surface, there's a myriad of emotional and psychological impacts, and that includes things like depression and anxiety, but also it impacts the way we develop and form relationships. It affects the activities that we engage in. And there's other things to deal with, like treatment burden and pain. But today I'm focusing on staring and unwanted attention. So staring is part of other unwanted attention. So it's people looking at you. You have to deal with that when you live with a visible difference like psoriasis. But it also comes with comments, things like, oh, poor you, that looks sore, what have you done? Have you burnt yourself? So there are often lots of questions. And when you're a child or an adolescent, they're often directed to your parent and not you. And many people have experienced teasing, which is often intended to be good-natured but doesn't feel it. And many people have experienced bullying, myself included. I remember one particularly upsetting occasion when I'd gone to our local pub in a skirt because it was summer. And while I was there, a young man who I didn't know pushed his finger into my leg to make all his friends shriek and gasp with horror. you know, I don't expect they thought about the impact that would have on me, but it was quite devastating. So all of this unwanted attention, including staring, leads people who have visible differences to start to feel ashamed of the way they look, myself included. I want to spend a little bit of time thinking about shame, and the impact of shame on our lives and what we do and what we don't do. And it's not just the staring and the unwanted attention. Oftentimes it starts with that, but we start to fear being judged. We start to anticipate people looking at us, staring at us, commenting on our skin or our differences. And shame also arises for not being able to do the things that we want to be able to do, and having to ask for help, especially if you live with things like psoriatic arthritis. People with visible differences start to talk self-critically about themselves, and that's quite common. And there's a really big part of societal beliefs and media images. They play a big role in this. So we live in a society where perfect glowing skin is prized, and it's assumed that people with perfect skin are eating well and sleeping well and exercising and managing their stress. And what that means is those of us who don't have perfect skin are doing some, if not all, of these things wrong. Of course, that's not the case, but these are the myths that we have to deal with. So I'm not alone in feeling shame about my skin. Other people with psoriasis and certainly other skin conditions and visible differences report being stared at, teased and bullied, especially during adolescence. And shame is a very common emotion that arises from that. Now, shame is a moral emotion, like guilt and embarrassment. But whereas something like guilt is associated with the thoughts, I've done something wrong, with shame, it's very much associated with negative self-evaluations. So you start to feel, I am wrong, that I'm flawed, there's something wrong with me. And in psoriasis, we know that the level of shame someone experiences is not related to their PASI score, which is a score of psoriasis severity. So somebody with very severe psoriasis won't necessarily have lots of shame, and somebody with mild psoriasis may have experienced a lot of shame. So it doesn't correlate well. But what we do know in psoriasis is that the longer you've had it, the more shame you feel. So the fear of unwanted attention, the experience of being stared at, results in shame, and this can have serious consequences on people's lives, myself included. We start to hide our difference. We start to cover up. We start to avoid activities where our difference will be revealed. So for example, I wouldn't go swimming. We can start to isolate ourselves from other people. And this has a big impact on things we do, and then we have difficulties in our daily activities. But not only that, it affects the grades we achieve at school. And we know from research that people who are prone to shame are likely to feel angry and respond with anger to things. And they're much more likely to use substances as a way of distracting themselves. So almost a kind of self-medicating with smoking and drinking and maybe taking drugs. And people who are prone to shame have an increase in stress hormones, and this can make life feel very unpleasant. And people feel anxious and worried. So as a psychologist, I know that there are lots of things that can help. In my talk today, I'm going to focus on cognitive behavior therapy, which is just one of the many things that can help people deal with unwanted attention and the feelings of shame. So cognitive behavior therapy is very simply based on the idea that what we think affects the way we feel physically and emotionally, and it affects what we do and what we don't do. So for example, if I hear a bump in the night and I think it's a burglar, then my heart will start racing. I'll start to feel very afraid. I might hide under the duvet. If I'm feeling brave, I might go down to see if I can see what's going on. But it's really going to affect the way I feel and what I think. So I hear the same bump in the night, and I just think it's my cat knocking something over. Then chances are I'm going to stay feeling sleepy. I'm going to turn over and go back to sleep. Similarly, same bump in the night. If I think it's my son coming back from the pub, I might feel a little annoyed. I might wonder if he's okay, and I might go downstairs to see how his evening was. So it's the same bump, but the way we think affects what we do or what we don't do and the way we feel. So our thoughts arise automatically and they run in the background all the time. And we often don't pay too much attention to them. So while you're listening to me talk now, you'll have a running commentary going on in the back of your head. And it may be about what I'm talking about, but it may be about what you're going to have for dinner or what you're doing tomorrow. It's very normal. Most people do that. But the thing is, we don't really stop to examine our thoughts, and instead we respond to them as if they're fact. But the important thing is our thoughts can be fact, but they may also be an opinion. So for example, we see a clown here. The facts are that it's a clown, has a painted face, it's colorful, and so on. But our opinion might be that it's funny or scary or ugly, and that will vary from person to person. So when you learn to do CBT, you start to become much more aware of that automatic thought process, and you learn to notice your thoughts and spot when it's opinion. So my experience of being stared at and other unwanted attention means that my thoughts about going into a situation where my skin is exposed is that other people will stare, I look awful, people are going to be disgusted by me. And then I feel very low, I feel hopeless and worthless. I may have physical symptoms like feeling tired, not being able to sleep, having a headache. And I may withdraw from situations. I may try and hide my skin and not go. So if I was doing CBT, I'd notice my automatic thoughts and I'd learn to notice when I was making thinking errors, like assuming I could mind read or predict the future. And the next stage then is learning to challenge my thoughts with more helpful alternatives. And at first in CBT, you start to write down your automatic thoughts and you write down challenges. And over time, it just becomes more automatic. And this then helps with how you feel and what you do or don't do. I want to share with you this little animation. This was drawn by my son, who was 15 at the time when he drew it, and I'm narrating it. And it explains how CBT can help with staring and unwanted attention.
What happens when you have psoriasis is that it's such a big issue for you. You become hyper alert to people noticing it. And you start to imagine it's a big issue for them too. So for example, I'm going out to walk my dog and it's a sunny day, so I decide to wear shorts, and I bump into a neighbour who stops to talk to me. Immediately I feel uncomfortable and I start to guess what they're thinking about me. What's wrong with her legs? Oh, that looks sore. She looks disgusting. Is it contagious? And that makes me feel pretty rubbish about myself. I feel ashamed and embarrassed, and I want to hide away. And then the next time I walk my dog, I wear trousers. The feeling of shame is so horrible that over time we avoid situations like that and we learn to hide our skin. We wear long sleeve tops and thick tights. We choose light coloured clothes so the flakes don't show on our shoulders. We don't go swimming. At parties, we try to stand with our backs to the wall so people can't see flakes of skin on our shoulders and backs. But here's the thing. I can't read people's minds. I don't know what my neighbour is thinking. I don't even know if they've noticed my skin. So what if I'm wrong? What if instead they're thinking, oh, what a lovely dog. I wonder if I should get a dog. Or, oh, what are we having for dinner? What have we got in? Or, oh, I need to get home or I'll miss the start of the show. Or even, I wish I'd brushed my hair before coming out. I didn't know I'd see so many people. If they were thinking that, then I would feel okay about myself. I wouldn't feel ashamed. I wouldn't need to hide away next time. And so I have to remind myself I'm not a mind reader. I can't do that. And so I can't assume people are being critical of me. I don't judge other people. So why should I assume that other people are judging me? And then at the end of my dog walk, I'd still have psoriasis. I'd still wish I didn't have psoriasis, but I wouldn't feel so ashamed of myself. And that would be good.
So I want to end with just a little plug. I hope you forgive me for that. So this is my book that's due out next week. It covers the emotional challenges that I showed you with under the water on the iceberg, and also self-help strategies that can help you cope with them. It's available for pre-order from the publishers Sequoia, and I believe from some bookshops. And if you follow that QR code, you can use a 20% discount. So diolch yn fawr, and I look forward to getting some questions to answer for you. Thank you very much.
Thank you very much, Catherine. That was brilliant. Thank you.
Thank you.
Really, really good. And there'll no doubt be questions at the Q&A session in a minute, but actually now we're going to hear from Rebecca